Well, hello and welcome everyone. I'm Beth Stewart, and on behalf of the Texas Oral Health Coalition, I'd like to thank you for joining us for the fourth webinar in a specially designed health communications e-learning series funded by the Delta Dental Community Care Foundation. This learning series is a product of the Texas Fluoridation Campaign, a collaborative partnership between the Texas Oral Health Coalition, the Texas Health Institute, and the University of Texas Center for Health Communication in an effort to provide detailed information on how to create successful health messages to improve health outcomes. Today's presentation could not be more timely. We see how social media reflects the power of social networks in shaping our health attitudes and behaviors. During today's presentation, Building Your Social Media Presence, attendees will explore some common myths about social media and how these platforms shape attitudes and behaviors. And you'll learn 6 ways to build your social media presence, and by doing so, raise the visibility of oral health. To learn more about any of these presentations in this learning series, or take a previous course online, please visit the education page on the TechSOC website at www.techsoc.org. Our presenter today is Matt Jacob, who many of you know and have worked with over the years. Matt's efforts in communications have been recognized or honored by a variety of organizations, including the Association of State and Territorial Dental Directors, National Public Health Information Coalition, HealthLiteracyMonth.org, and the New York Times. He graduated with a bachelor's degree in journalism from the University of Arkansas in 1985 and previously managed communications and marketing activities for the Pew Children's Dental Campaign and the Children's Dental Health Project. Matt is known for translating complex scientific content into messaging that is clear, concise, and compelling, and most importantly, comprehensible to policymakers or the lay public. For more than 20 years, Matt has helped nonprofits and advocacy organizations raise the profile of their issues, particularly in the areas of health and education. It is my pleasure to introduce you to Matt Jacob. Matt, the controls are yours.
Thank you, Beth. Can you hear me all right?
Yes, we can.
Great. All right, just wanted to check the audio levels. Well, good afternoon and welcome. There are some of you perhaps who are, it's not yet your afternoon, but in any case, I do thank you for joining us and carving out an hour of your busy day to go on a little adventure. And I would say the last 24 hours has been a bit of an adventure for social media. I'll touch on that momentarily, but let me first begin by giving you my disclosure, just so you know how things stand. I'm excited about this presentation because I kind of want to divide it into 2 key areas. The first area is to look at some of the common myths that I think shape people's perceptions or decisions whether to engage in social media. And then the second is 6 tips that we're going to walk through. This is a question that a lot of people have been asking over the past several years. As social media usage has steadily grown, we have a lot of people grappling with this. You know, the social media platforms, are they well managed? Are they being misused? Are certain groups or interests, you know, stepping in, manipulating, posting content that's false, etc. And certainly this has great implications for science and public health, and more specifically about oral health. And so this certainly has been an important debate to have. Conspiracy theories and myths, we know those circulate on a variety of issues in social media. And so, you know, it's appropriate that we would raise these, that we would grapple with these and figure out what can be done, what responsibilities and roles belong to these platforms, and what as users can we do to try and make sure that the content is balanced, that we make sure that we're not allowing information that is false or misleading or incomplete to just stand there on their own and potentially influence and mislead people about health or medicine. So this is kind of the challenge we have. And last year, two physicians from Canada had an interesting article they wrote for the Journal of the American Medical Association, where they were very passionate about this. They talked about the torrents of misinformation, that's their phrase, that existed online and in social media on a variety of common or popular health issues, including vaccinations, fluoridation, and other topics, and what a challenge this was. I think most importantly, they didn't just identify the problem, but Dr. Armstrong and Dr. Naylor went one step further, and they really saw a role, a responsibility on health professionals, organizations, institutions, and mainstream media to step forward and have a role to play in making sure that this kind of information does not stand. So let's first step into the world of myths, right? We often talk about myths that are circulated on social media, but there are myths about social media as well, and I want to tackle those head on, because I do hear people occasionally make comments about social media that I think are somewhat misleading and may reflect a lack of experience with social media. I have my own complaints, I can assure you, about social media platforms in some way, but I want to tackle these because I think these can distract, unfortunately. So I will sometimes hear people say to me, well, social media users, they're not diverse. It's mostly, white people, young people. If that's who you want to reach, fine, but it doesn't really hit the other groups, demographically. And it may be true that in the beginnings, social media had that kind of a demographic profile, mostly white, a millennial-driven phenomenon. But those days are gone now, and there is some kind of platform somewhere that does seem to enjoy very broad use by people of a specific gender, people who live in a particular area, urban versus rural or suburban, people of different races or ethnicities. So we really can't say this because the numbers just don't bear this out about a lack of diversity. And I'll talk a little more about that momentarily. Our target audience, it doesn't really use social media. I've heard people say that as well. And my quiet response is, really, that's not what the data show us. And this is one example. The Pew Research Center did a very extensive survey of Americans to see about their social media usage, what platforms they had a presence on, and so on. And this is what they found. Interestingly, Facebook, pretty even use, roughly 70% plus or minus among white, black, and Hispanic Americans. So, definitely, if you're trying to reach, a target audience that it falls into one of those three or all three of those categories, then it doesn't seem like you're going to be missing them if you do take a look at that platform and do try and engage there. On Instagram, the story's a little different. That's a platform where you're actually a little better positioned to reach people of color than you would be on others. It actually skews slightly in terms of usage habits to Black and Hispanic users. And that's also true for Twitter. There's a slight uptick among Hispanic or Latino users as well as Black users. So, the idea that you're not going to reach a particular race or ethnic group is not really borne out by a lot of these facts. What about income levels, right? Maybe you're trying to reach a disproportionately lower income group. Even there, as you see, there's a lot of activity. Roughly 2/3 of low-income Americans are engaging, have a presence, a regular usage pattern on YouTube and Facebook, and roughly 1/3 of them are active on Instagram. So yes, there's a slightly lower percentage of use. I think that might be explained more by the challenges they're going through day to day, week to week in their lives than it is to kind of a personal preference. If they had more time, if they weren't facing some of the stresses they are, that might actually look much more similar to the demographic group that's right below. So just something to consider. I hear people say, oh, Matt, I heard your presentation about social media. I wish I could do that stuff, but I just don't have the time. And I respect that. I understand that some people really do have enough on their plate that they personally can't do it. But in many cases, someone with their association or their organization or their chapter might be able to play that role. I think sometimes there's some misunderstandings about the amount of time that it takes to have a presence on social media and to have an impact. It's also worth understanding that most of the major social media platforms, they have mobile apps that make it possible to engage pretty much anywhere, anytime. You can be in your car, you can be waiting on something. You don't have to sort of have a desktop or laptop computer at the ready to do this. In addition to that, there are applications you can use that allow you to pre-schedule a social media post. So perhaps you'll be in a training, or you'll be attending a virtual conference for an hour or 90 minutes, but you'd like to make sure that a message gets out about something your organization or your group is working on. You can still do that. You can preset those messages through some of these apps. And Hootsuite, Sprout Social, those are just two examples. There are other apps as well. I hear people make comments about, well, what's the point? A lot of the people on social media, they seem very gullible. I've heard this a few times. And that's not really borne out by the data. There was a poll done by the Media Insight Project several years ago, and this is what they found. The orange group is the trust news a great deal or a lot. The yellow or gold bar, that part of the bar, is they trust the news they see on these platforms somewhat. And then the blue is I trust the news a little or not at all when I'm on those platforms. And look what we have here. LinkedIn is the social media platform where people are most likely to say, I trust the news that I read on that site a great deal or a lot. And it's only at 30%. So I do think that people are a little more deliberative. They are a little more, I'm going to kick the tires, I'm going to ask somebody else than we might think they are. Yes, there are some people who will make assumptions about something they've read or heard, but I don't think we should assume that everybody on these sites is gullible and anything they're told they will automatically believe. We do have an audience that is able to try and make sense of these issues and will at least often listen to others, look for other opinions and perspectives. I've heard some people say, well, isn't social media use dropping? They've had some concerns, some controversies. And so, aren't they really seeing a big drop off in usage? Actually, no. Despite some of the controversies that have come up, the percentage of American adults who say they use the leading platforms or apps is basically unchanged from early 2018. So the use is still there. This is very much baked into our lives. We see this as a way of connecting us with professional colleagues, connecting us with family members, connecting us with other friends and acquaintances. And the idea that people are just going to abandon this, whatever their concerns may be and justified, is an assumption we shouldn't make. Platforms are doing nothing to monitor the content. Have you read the stuff that's on Twitter or Facebook, or did you see that ad that appeared on this site or that site? I hear that a lot too. And a lot of what I had sent to me or forwarded to me, I would agree. It's troubling and it's annoying and difficult to grapple with. But at the same time, I think that because this has become a very public issue, and because, frankly, a lot of medical and dental professionals and public health officers have raised concerns, these platforms are slowly but steadily starting to take action. And this is one example down below on the screen you see. Twitter actually adjusted its algorithm so that whenever somebody is looking for information related to COVID, they will actually see this first and foremost. They'll be encouraged to go to the CDC's website. So there is kind of this first stop. This is where we're going to orient people They may dig and go to other sites and explore elsewhere, but we are really trying to give priority to NIH, CDC, and HHS as resources, and I think that's helpful. Even Facebook, here, I just did this as an example. I went onto Facebook recently and just typed in HPV vaccine to see what would happen, and this is what I got. And it turns out if you type in vaccine of any kind, just vaccine by itself or flu vaccine, this is basically the screen you're going to get. So they're directing you, first and foremost, highlighting the CDC. You see the looking for vaccine info headline, and then below it you see the American Medical Association. Then further down you see other groups as well, the CDC and some others. So there is an effort being made to really indicate which sources are going to provide people with the best information, rather than just letting a free fall of information reach a user. Hate speech is an issue that's certainly prompted a lot of discussion recently. Some companies have been pulling ads on Facebook over their concerns about what has appeared on there. And I think there are legitimate issues to look at and to discuss, and obviously individuals and their organizations have to keep monitoring this issue and see what the platforms do. And it certainly pays to send messages directly to the officials of these platforms if and when you have concerns about something you've read or seen. I think we all as users have that responsibility as well. And I'm hoping this issue can get ironed out. This is something that people may be thinking about today, because within the last 24 hours, of course, we all saw that news story about some Twitter users having their accounts hacked. I think there were a variety of them that were hacked. Elon Musk, Barack Obama, a variety of celebrities, business leaders, actors, but these were very high profile people. These were people promoting Bitcoin, and what they were doing is looking for accounts that had a very high number of users, not 200, not 6,000. They were looking for people who had hundreds of thousands, if not millions of followers. So I think what I would say to this is, obviously we have to stay on our guard, and I think we all want to pay attention and see what Twitter proposes to do and what happened, and if there was a breach internally, what they're going to do to address that. But I think it's important to know that hackers in general tend to target very high profile people, and not to insult any of you out there or myself. I'm not sure that we would fit on the list. We would quite show up on that list of priorities for hackers. They really are looking for the people who have hundreds of thousands or millions of followers to get their messages out. Having said that, it always makes sense to do what you can to curb your risk of being hacked, and there are some ways to do that. And these are just two examples. You can change your password regularly. Some of us, and I'll raise my own hand on this, don't do that as often as perhaps we should. And of course, there is two-factor authentication. It's one way of just an added layer. And if you want more information on two-factor authentication, you can visit this website, and they actually walk you through how to actually put into place two-factor authentication for use of Instagram, Facebook, or Twitter. So my understanding, and Beth can confirm this later, that these slides would be available to participants, so you could get this web address, or we can email it to you. Using these social media sites, it would just validate the objectionable content. I had a friend say that to me. Yeah, that I don't use them because I'm just afraid it would validate the objectionable stuff that is on there. And I mentioned to her, I said, recently there were a group of researchers and academics on Twitter that helped expose a lot of the problems with this Lancet study, which has since been withdrawn. They demonstrated that the conclusions were not accurate, that the data may have been compromised or fabricated. And so, this isn't a situation where using social media, in some cases, can actually help to expose objectionable content and be a victory for science. So, it's not all everything negative here. The glass is half full, and in some cases like this, I think we can celebrate the fact that people are monitoring and paying attention and want to get it right. So I think in short, we've talked about these myths. You know, walking away or ignoring social media will do nothing to improve the quality of its content. And I think whether you're an oral health advocate or you work more broadly in healthcare or public health, I think we all have an obligation not to allow these platforms to be dominated by people who would circulate false, misleading, or incomplete information. We need to be part of that process. We need to be engaged rather than sitting on the sidelines. The analogy I used recently with one of my siblings was, you know, when you drive a car, you are likely to see some people who are driving their car in a way that is either inconsiderate to you or downright unsafe. That doesn't mean that you suddenly throw your keys away and say you're not going to drive anymore, right? You're still going to, you understand the rules of the road. You're going to drive in a way that's safe, that's appropriate, that's respectful of other motorists. So, I think disengaging is not the answer. So, the good reasons for doing this. What are some reasons to really do this? Well, I see this as something that's a very low cost option for us. And I say low cost because time is a cost. I think that, you know, the time we spend means we can't spend it elsewhere. So there is some cost, but I think it's a relatively low cost that can help us raise awareness of oral health issues, especially among those who we just don't tend to cross paths with over the course of a day or a week. And so reaching new people, the oral health field, I think, as we all know, is not flush with money. Our programs, our organizations, we have to really watch every dime. We don't have the kind of funding level that allows us to run huge marketing campaigns. We really have to use every tool at our disposal to get the message out, to interact and collaborate with people so that public and patients have a better understanding. Being on social media also validates you or your organization as a player. You know, I think we've gotten to the point now that if you're an association, if you're a large dental or medical practice, you know, if you are a chapter of a dental hygiene association or state dental association, and you don't have any kind of social media presence, that actually, I think, is a bad reflection on you. I think people sort of are expecting, well, wait a minute, you don't even have a Facebook page, or, you know, do you guys have a Twitter account? I'd like to follow you. Answering no is something that really sets you apart from most stakeholders. And last but not least, I think it's important for those of us, whether you are a health provider, whether you are a public health officer, an epidemiologist, a health communicator, I think being aware of what's out there, what are patients in the public hearing, what information are they seeing, just having a sense of how certain issues or topics are being discussed is going to provide some helpful insights, you know, so that when you are engaging with the public, when you're talking to patients, you have just a little more of a sense of what their world is and some other information that may be floating around, a meme that could potentially mislead them. It might help you adjust a little bit how you talk about that issue. So I think that's worth considering as well. This is about social networks. It's called social media for a reason. It's about social networks. That really is what it comes down to. And what I mean is social norms, right? So we know, those of us who have read public health research, we understand the pull that social networks have. Whether we say we are or not, we do remain mindful of what our peers, what our neighbors, what our friends, what people who think like us or look like us, what they're thinking, what they're doing, the decisions they're making about their lives. And that pull can be quite powerful. So here was a study that was done 2008, and what they found was, of all of the appeals, of all the messages they used to encourage people to just lower their thermostat a notch or so during the summertime, the most compelling, most effective message they could use wasn't, hey, you'll save some extra money, or this will be good for the environment. The most effective message was the message that appealed to them to join their neighbors, right? So implicitly, hey, your neighbors, we've gotten more of your neighbors to do this. Why don't you join with your neighbors and all of you will do it as a community and have this impact? So it does seem to have that association. This is another study, and it was perhaps a bit more disturbing, which was that this was done in the greater Seattle, Washington area. And they found that the factor that appeared to be most important in determining parents' decisions about whether to vaccinate their children was the percentage of parents in their social networks that were recommending nonconformity. If they were participating in a local neighborhood web board or bulletin board online where there was a pretty good number of parents, mothers and others who were saying, you know, I'm not going to vaccinate, I don't think that makes sense, or I'm going to rely on them getting it and they'll get herd immunity. You know, if they heard those kinds of messages, they were much less likely than parents who were not exposed to those kinds of messages in their social networks. We know that dietary decision-making about what we eat, what we drink, that can be impacted as well. And social media feed, there's been research that has actually shown some association there, that the messaging that goes into somebody's social media feed can have leverage. It can have impact in reshaping the dynamics that lead them to make certain decisions about what they eat, how often they snack, what they drink. One of the authors said, we can use social media as a tool to nudge each other's eating behavior within friendship groups and potentially use this knowledge as a tool for public health interventions. So again, it's sort of those people who are closest to them, friendship groups. That's where a lot of pull is. We mentioned earlier, you know, don't assume people are, you know, going to believe everything they say. Are people gullible? Here are a couple of comments from the Media Insight Project research. These were what social media users said when asked, how do you decide what you're going to trust, what you're going to believe? And I thought these were pretty logical, straightforward answers. You know, they looked at who shared it, right? I mean, they're really relying on the kind of confidence or trust they have in that friend or that colleague. And so I think, you know, their considerations seem pretty logical to me. Finding the best platform. So, you know, I think sometimes what can happen is there's this tendency for people to say, hey, you know, social media is the thing. We should be doing this too. So I'm going to open a Facebook page. We're going to have that. We're going to have an Instagram account. We're going to have a Twitter account. We're going to do all these things. Isn't this great? And they get overwhelmed very quickly. And they find that they haven't posted something on their Instagram page in 3 or 4 weeks. And there's not much sense in having a presence that you're really not going to invest some time to. And so I really think it's important to be strategic and to choose a platform if that's all that time and your schedule and your interest, you know, really justifies, rather than trying to spread yourself thin. You know, do what is doable. And these are key questions to ask as you ponder that. First and foremost, who is your primary audience? If you are a membership association, the answer might be your members, right? But it could be the patient population in your particular community or your part of a state. It could be others as well. It could be people who have traditionally been somewhat isolated and have not been served by the dental care or medical care system in this country. Whoever it is, you really want to flesh that out and have a kind of shared understanding about that. Secondly, look at these platforms, you know, look at the demographics, who they serve, you know, who they reach, and figure out which one or ones, if you do have time for more than one platform, would be ideal for reaching that target audience. And third, you know, how much time do you really have to devote to social media? It's an important question to be honest about. It's not going to take many hours every week, but it does, you know, the more time you do invest in it, the more effective you can be. So these are important questions to ask. And these are important considerations as well. You know, just take a look at these 5 different platforms. Obviously, this doesn't even begin to reach the the diversity of social media platforms that are out there. But these are, I just kind of put together some very quick notes on what tends to distinguish some of these social media platforms from others. I think some of you are familiar with LinkedIn. It began very much as you kind of put together an online resume, and now it's much more about kind of collegial, professional, find your professional field and connect, reach others who may be in related fields. This is one audience that is disproportionately affluent, doesn't reach rural residents a lot. So that's the kind of consideration you'd want to take into account. Twitter is very much connected with the news cycle. And tends to be more popular with adults under 50. So, I think that's something that's important. Instagram tends to skew a little bit younger demographic and is a little more likely to be female than Twitter is. So just things like that you want to be aware of before you just kind of dive in and say, hey, I think we'll do this social media platform. And then it's always helpful to think beyond the major platforms. There are social media networks, local sites that are customized to be places where people within a neighborhood or a certain area of a city or state can get together, can connect online, and can share information about cultural events, can update each other. If somebody in the neighborhood, had COVID and someone else might have been exposed to them, at a park or somewhere else, that could be information you could share in that manner. Somebody's moved in and, you wanted to find some way to welcome them while maintaining social distancing. There are a lot of conversations can be had. Nextdoor has a presence really nationwide. This is a social network for new millennial moms that I kind of stumbled on a few years ago. Someone in Connecticut brought this to my attention. And I thought this is the kind of site, if you have somebody in your organization who, might be able to connect to this or log into this and posting some information about oral health and the importance of oral health care and services during pregnancy. This could be a very relevant place to go. You're going to reach your target audience, right? So, it's just, you want to have these kinds of platforms also on your radar screen because they may be useful as well. All right, so without further ado, let's look at some strategies that you can use to build your social media presence. They may be new strategies to you. You may have heard these strategies before, but I'm going to try and at least provide enough detail that maybe I'll get you thinking a little bit differently about what that strategy entails. So without further ado, the 6 tips are going to focus on these 3 platforms for a few reasons. They are, I believe, diverse enough from each other. At the same time, they, I think, are good places for oral health advocates to try and maintain a presence, if not all of them, certainly on, picking one of these that might be most appropriate. I think, Instagram, as many of you know, is really about visuals, video clips, really interesting, cool photos and graphics, much more so than Facebook and Twitter. The message is usually almost secondary on Instagram. You want to keep that fairly short. Twitter, as I said, very much connected kind of with the news cycle. So if you're an organization that produces reports or shares data on health, that can be a good space and place. Facebook, I think just because you're really not missing any big demographic. I mean, Facebook really is kind of that, it reaches so many people. Just, the stat that really kind of, that kind of knocks me out is that there were more than 2.6 million active users of Facebook globally in the first quarter of 2020. 2.6 billion monthly active users. So we're not talking about people who posted one thing and then 4 months later came back, like monthly active users. That's a pretty, impressive figure. So tip number 1 is target your audience. I think a lot of times when we post a message, we may kind of approach it in a different way. And one of the things that happens is, I tell people, we are not a nation of readers. We are a nation of browsers and skimmers. We are glancing. we are catching a keyword or two, and then we're moving on. If we don't think a message appeals or applies to us, we're moving on. We're not going to stop and read the second sentence and the third sentence and the fourth sentence. We are glancing. Does this seem like it's for people like me? Okay, yes, no, then we move on. So you really want to do what you can with the very first phrase, very first sentence or question to target who is this for, right? And the beauty of this is that question makes it very clear. You know, we're talking to people who have children who are around age 5 or 6, right? This was a Facebook message that was posted on the Children's Dental Health Project website. You know, do you know someone who's pregnant or a brand new mom, right? We make it very clear. This performed better than any other Facebook post that year. This was 2017. And I think it was in part because it was very clear who this was for. And, you know, Facebook is about sharing. There's a really strong inclination to do that. And so, you know, as opposed to like Instagram. And so I think the idea here is, oh, you know, if I see this and I have a cousin or a friend who fits this description, right? They're pregnant or they're a brand new mom, this would be a cool thing to share with them. This is another example. This was on Twitter. So this is somebody who is a dentist and researcher on the West Coast, and he makes it very clear who he's talking to, right? He even uses the hashtag. We'll talk a little more about hashtags in a moment. But he says, attention, pharmacist on Twitter. So he makes it very clear right away, these are the people I'm trying to reach. And so, you know, if you have a question like that and you really want to reach that audience, that's a good way to make it very clear. And then even just in the way you kind of roll out your message can have a positive impact. This is a public health columnist who writes for a Canadian newspaper. And, you know, he starts out saying parents can't wait around forever. And he's talking about the issue of kids returning to school in person amid the pandemic. So he's making it very clear who he feels would be most interested in reading this story. So, you know, again, targeting your audience right away, make it clear who you think this story or information is going to interest. That's going to pay dividends. People will be more likely to click, to engage in some way. Tip 2 is using hashtags to extend your reach. And, you know, I see people who are very good at doing this and others who it just doesn't seem to be on their radar screen, or they're in a hurry and they don't stop to think about it. So for those of you who don't know, hashtag is the # or number sign right before a keyword, phrase, or abbreviation, no spaces, right? They are popular on Twitter, Facebook, and Instagram. I will say this, they are most popular on Instagram. They are fairly popular on Twitter. Facebook, they have gained some traction, but it hasn't really grown much. And so you see most messages don't have any hashtags. Occasionally you might see one. So it's just a little different place culturally. These hashtags make it easier for others to find you and your message. That's what makes this so important. You may have something really interesting to say, but if I'm not in the oral health world, I don't live in your community or your state, there's a good chance I may never see it. So the only way your message would find its way to me is if you have a hashtag that is about a topic or a subject that interests me, that I might search and go, wow, what's this? So this really is what hashtags come down to. So how do you decide, which hashtags you might use? Well, I think it makes sense when you're searching for hashtags to see how often it seems to be used. You'll click on a hashtag and you might see the last time it was used was 4 minutes ago. If the last time it was used was, June 17th, probably not a hashtag that a whole lot of people are looking for, right? You really want to pick a hashtag that almost every day somebody's, searching, looking for, or including in their messages. It can also be helpful to look at the hashtags that your partner organizations or rival organizations are using within their messages. And just, it can expose you to some new ideas for hashtags. You want to choose hashtags that align with the topic you are posting about and who might be interested. The last thing you could do is somebody finds your message because you included a relevant hashtag to them, but they read your message and they think, well, this doesn't make any sense to me. So just something to think about. On Facebook, this is where you search for hashtags, right? You write plugin top left, top center Instagram, the top right on Twitter. You know, you can plug in any hashtag there and just see where it's being used, who's writing about it, who's including it. So here's an example of where you have hashtags not used that efficiently, right? So they have them here at the end, but wait a minute, they used COVID-19 earlier in their tweet. So why not just put the hashtag right there? And the same thing with asthma. They added at the end, but they could have just embedded it in the sentence, right? And just put the hashtag right before the first time asthma appears. And that can be helpful just because it means your message is going to be shorter, more efficient, and the shorter messages tend to get read and engaged with much more often. Here's a hashtag I thought was kind of interesting. I thought it was cool, that science is cool. And again, I included it in the sentence rather than just kind of adding at the end. It just meant that it was a little more efficient way to kind of use it. There are a whole lot of hashtags that oral health advocates could use to break out of their cubicle, to break out of their little bubble and find people who would care about oral health and find it very interesting and could be potential future partners if they know what you're doing, right? So if you're focusing on something relating to the oral health of older adults, this can be a good hashtag to use, healthy aging. You know, if you're talking about a kindergarten oral health assessment, you know, putting this hashtag in is going to be helpful. We know about the strong links between oral health and diabetes. Again, that can be used. Health equity. There are a lot of them here. In Texas, you know, there's a hashtag that is really much targeted to legislators in Texas if you want to bring a policy issue to bear. And then most states have a hashtag of some kind that's fairly active that says Texas Parents. So if you're trying to reach parents with tips or information, that can be a good place to go as well. But as I said, I see people occasionally who there are obvious terms that could make really good hashtags and they're not using them. So again, I think it's a missed opportunity. Really look for ways that you can embed hashtags so that more people are likely to see what you have to say. How many hashtags? Well, probably want to limit them to 4 on Twitter, probably no more than 1 on Facebook. Instagram, they'll use a bunch. I would say kind of limit it to 10, but you can use up to 30. Another approach is to tag someone. This is tagging someone. You use @ on Twitter or Facebook or Instagram, and you're basically finding an account, right? There's somebody else out there. Facebook has the same thing. And so, you know, I included them in this, and Attendance Works, a group that focuses on school attendance and school readiness. They saw my message and liked it. So that told me they saw it. They actually read it. Beyond just the hashtags, you know, again, direct messages, they find people. This hashtag, parenting, was the only reason why Parent-Driven Development actually saw this message. They don't follow me, but, you know, by including that hashtag, it helped. You don't want to go overboard by tagging everybody, right? And so here's a case where First 5 LA included the hashtag of the Luskin Center, but it was a project they had collaborated with them on. And so Luskin Center certainly knows who First 5 LA is. And so this is very appropriate, but you don't want to make this a habit of tagging the same organization, you know, 3 or 4 times in the same week. That's almost kind of bordering on social media stalking. Tip 3 is to share a provocative or aspirational quote. You know, let your hair down. You know, tell people what you believe. What is your creed? What are your core values that drive you personally or professionally, your organization? So this is one example. This is another example, you know, of just kind of putting a quote out there. Every once in a while, it's a nice way to kind of break up the kind of content that you generate. Sometimes you'll find a provocative quote from a news story. And that's what the New York Times health section did here. They used a quote from a high school student about e-cigarettes. Kaiser Health News used this quote from an older adult who was talking about, you know, aid in dying policies. This is a quote I took from an article that I thought was pretty provocative. You'll notice I included a few hashtags as well. And the person who made that statement, I tagged him. And this is so far the best performing tweet I've sent all year, 77 likes, 48 retweets. But I think sometimes a quote just really kind of connects with people at a particular point in time. Visuals are very important too. Engagement goes way up when you include visuals. And certainly one kind of visual is video. People, while it's becoming more common, it's still not so common that people do kind of gravitate toward it. Here's one where Delta Dental of Colorado shared this, right? So, it's one thing to say, what's it like to go to a dentist in the age of COVID-19? You could, produce a document or a one-pager, or you could write that into your Facebook page. They have somebody on screen. This is something that'd be so easy to do. You get your iPhone out, you get your smartphone, you just film it. I mean, this doesn't have to be more than 20, 30 seconds, or, just to give people a sense of what's going on. It's just another way to reach people. People are more likely to dive into this than they are to read 2 paragraphs about it. The Surgeon General has a very prominent, very high profile presence on social media. I follow him on Twitter. Again, he's got a video here and he just has a very brief lead in. Good hashtags. This is an oral health advocate in Washington State, sharing a video. So, video content really drives up engagement. And so to the extent that you have it, you're creating it as an organization or you can find it, definitely something to consider. Fox did this one brief video about how coronavirus spreads. Visuals also can obviously be graphics or photos. And here's a good example. Here's a photo that kind of makes you almost want to dive into that picture. I mean, on a hot summer day. If you can find nice photos, nice images, really does add something to your messaging. And, but it can also just be an interesting banner, a web banner or something that is out there. And Google Images, of course, has millions and millions of different things. But this is kind of a cool, slightly different, artsy approach to an issue of good eating, healthy eating. This was from a conference that a health equity group in Colorado produced. They jotted down some notes and they just snapped a photo of it and upload it, right? It's not that hard to do. Take your photos if you can't find them. This is one that some of you may have seen, out on Google Images. A lot of people are sharing that. There are other ways though too, right? So, when we get back to the days of non-virtual conferences, right, a lot of organizations and associations put a lot of money into booth displays, exhibit booths. There can be some really cool visuals of that. Ask someone to snap a photo of it, upload it to your Facebook page or your Twitter or Instagram. It makes a nice visual, right? You invested all this money in it and don't just sort of let it stop there. It can be a nice excuse for an image. You may say, hey, our executive director, our leader, is being interviewed on TV. Don't just tell them about it. Show them that he or she was on TV, right? It doesn't have to be a super fantastic image, but it's just a good way of illustrating, hey, this happened. There was a TV interview. Don't just talk about your mobile dental van. Show it, especially when it looks like this. This for a mom, a dad, a caregiver. This looks like a very professional, very efficient, place. It doesn't look like a dangerous place for my child or for me to get care. So this is part of the visual, is part of selling it. And drawing your interest. Notice as well, one of the things Facebook does that is really kind of cool is if you want to use this as an event scheduling kind of vehicle, Facebook is very much going to help facilitate that. So there's some cool, functionality that they have as well. Health observances, days, weeks, months. There's usually some image on Google that a sponsoring organization like the WHO has, whether it's cycling, whether it's National Children's Dental Health Month, National Women's Health Week, a whole variety of relevant observances, find those. I mean, the organizations are not going to be upset with you. Frankly, they'll be thrilled with you that you're using their branding, their banners to help promote it, get it out. So that can be helpful too. The graphic can do most of the work for you. A lot of these graphics are very powerful. They don't require a lot of chitter chatter. This is one I found that a county health department in Illinois had. I thought it was a real excellent, example of a graphic. This is the New York State Department of Health. it kind of stands on its own. These three platforms, Twitter, Facebook, Instagram, they all have a live streaming functionality. So if you did want to, do something live and put it on there, you obviously have that as an option as well. Be careful about visuals. There are some that I really would steer away from. You'll see a lot of on Google Images, dental instruments. I think sometimes these can actually cast oral health and dental care in a negative light. They remind people of what they fear about oral health rather than how oral health care can really improve their life. So just kind of be mindful of that. Certain graphics, as you place them on your page, whether it's Instagram or Twitter, don't just hit send and walk away. Take a quick look, see how it displays. Some of these things may need to be resized to display properly, things that you might be able to fix. And there are a lot of places you can go to get videos and upload to your pages. The American Dental Association has a variety of informational video, Campaign for Dental Health, which is an AAP project, the Mighty Mouth, which is based out on the West Coast. So there are sources out there. It's not like you can only get video if you make it or create it on your own. There are other places to source. Tip number 4 is to get right to the point. So, don't beat around the bush. You really want to, get right to the point with your message. And when you do that, people are going to be more likely to engage and understand what you're saying. This does not get right to the point. It kind of teases the reader. Well, what are you talking about? Check what out, right? People need to get a sense of what they're going to find out. With the new poverty guidelines, an improvement or not, have a perspective. I kind of would look for a little more than just, hey, here's a new report, stuff like that. Be social. I had a brief little conversation on Facebook several years ago with an Alabama mother. And I was really touched by this. I think people want to share their story, and I could have just left her first comment alone, but I responded to it, and she responded by telling me even more. And, I think they call it social media for a reason. So, think about that social aspect. Direct message functionality, use that. That can be very helpful as well. Just because you like their tweet doesn't mean you can't send them a direct message saying, hey, I really, really liked your tweet. It was great that you posted that. If somebody's looking for a booklet or a resource, reach out to them if you like each other or follow each other on a social media platform. If you're putting out a press statement or a new report, let people know. They'll appreciate it. And then last but not least, have fun, be real. Don't take yourself too seriously. Show a little levity. This was a little poem that I kind of came up with. I think I'm better off as a writer than a poet. But anyway, I had fun with it. And a friend of mine did a breast cancer fundraiser, and I thought it was great. She posted these. There were more photos than this, but people were having fun with it. So even if it's a serious topic, you can still throw a little dose of fun into it. And this was something that the Oral Health Coalition in West Virginia did that I thought was just a nice way to connect. So here are the 6 tips for raising your presence. Just quick review of them, and I want to offer some final thoughts, then we'll open up for questions. So customized hashtags, they can be something you can use if you've got a new campaign and you want to sort of measure who's following it, who's participating, and you tell everybody, hey, use this hashtag whenever you share our information or our toolkit. So that's sort of something I really want to encourage you to do. You can do polling. On Twitter, certainly you can do polling, and these kind of instruments also exist on other social media events. So think about whether that might be appropriate or helpful. Calendar opportunities, we talked about that. Chats and storms, organizing these, hearing about them and participating. You will get more likes and more follows when you participate in these events, I can assure you. So with that, Beth, I want to open up for any questions or comments people may have.
Okay, great. Well, we do have one question. Let's see. How do we handle misinformation, spam towards us on platforms? Do we respond?
Yeah, I think without seeing it, it's tricky to respond to that. But I think what I would say is this. If it's somebody who clearly has has made up their mind, if they make it clear in how they write, if they send something to us that says fluoride is a toxin and you're terrible for posting this, they kind of they made it clear where their mind is, and I don't see much point in it. But if they do ask a question or they say something that reflects a gap in their information, I don't think it's a bad idea to respond and say, you know, have you seen this new report? Or I hear what you're saying, you know, but you might also want to know about some other information, you know, check out this website, you know, direct them to places where they can get more information, and have an opportunity to realize that they may not be spot on in their initial conclusion.
Okay, that's good. Here's another one. How would you suggest increasing reach on Facebook beyond hashtags? Is there anything else that we can utilize?
Well, you don't want to necessarily rush out and follow anybody and everybody, but one of the things is to follow organizations that you see as connected to sort of your broader mission. So if you, let's say you work at a pediatric dental practice somewhere, or clinic, and, you know, looking for stakeholders in your area of a state or in your city or town who, the United Way, if there's a local United Way chapter that has a presence on Facebook, and if there's a Head Start Association, if there is an early childhood center, if there are other organizations or stakeholders that are doing things in this area, I would definitely start following them and consider, depending on what they are posting. One nice thing about Facebook that sharing and commenting is so baked into it. Consider commenting on some of their posts and maybe saying, hey, you know, that was a great post. You know, here's an infographic I saw that you might find interesting. It relates to the importance of, you know, oral health during, you know, the first 3 years of life or whatever. So look for opportunities to engage. So sort of follow and then maybe look for an opportunity to engage through the comments and see if you get some sort of dialogue. They may end up following you as a result of that.
Right. Okay. Well, that's a good suggestion. Let's see. Are there any other questions? I'm not seeing anyone. And Matt, I do want to thank you for a wonderful and informative presentation about how to really effectively use social media. I've gained a lot of information and helpful tips that I plan on utilizing. So thank you again. This was very timely. Thank you again to our presenter, Matt Jacob, and to attendees for taking time out of your schedule to join us today.